Aging isn't about slowing down, it's about stepping into your power. Welcome to Don't Let the Old Lady In, the podcast where we challenge outdated beliefs about getting older and embrace wellness, self-love, and confidence. Your host is Lorie Gardner, a registered nurse and nationally board-certified health and wellness coach, and she is your guide on this journey to vibrant, mindful living. Each episode will explore topics that nourish your mind, body, and spirit, and how to navigate health issues in the healthcare system as you age, so you can live with energy, purpose, and joy. Let's get started. Here's your host, Lorie Gardner. Hello, and welcome back to Don't Let the Old Lady In podcast. This is the podcast for midlife women and beyond who are done shrinking and done being dismissed and done letting outdated beliefs define what's possible for their health, vitality, and future. Today, in honor of Heart Month, February, we're going to be talking about cholesterol, heart health, statin drugs. We're going to be talking about the signs and symptoms of heart attacks and strokes, so it's important. This is a very, very important subject, close to my heart and hopefully to yours. So tell me, ladies, have you ever been told, oh, your cholesterol's fine, we'll just watch it? Or have you been told, here's a prescription with a little explanation, maybe for a statin drug? Or have you wondered, does needing medication mean I failed? I thought I was doing everything right. Well, this episode's for you if you've been ever asked those questions and scratched the top of your head, because the real question isn't, do I need a statin or a medication? It's really, what is my true cardiovascular risk, and how do I want to protect my future and have the conversation with your physician? So, I do want to preface this by saying I am a nurse, but this conversation isn't about any kind of medical advice. It's simply about sharing a lot of good information that you can use to be an empowered and educated healthcare consumer and increase your relationship with your doctor by asking good questions and getting the information you need so that you can set your trajectory higher for heart health and minimizing your risks. So why are women still a little confused? But I want to start off first by saying that heart disease is still the number one killer of women. That alerts me for sure. But yet women are still diagnosed later, they're treated less aggressively, and often told to wait and see. And here's the truth most women don't hear. Heart disease doesn't start with chest pain. It doesn't start with a heart attack. It starts quietly, years or decades earlier, inside the artery wall. You know, I've seen this as a nurse. I've seen this pattern over and over. Women doing everything right, eating well, exercising, taking care of everyone else, and still being blindsided later with a major heart event. Not because they failed, but because no one explained risk, only numbers. That's what we're going to be talking about today. So there's a lot of physicians and longevity experts out there, and they're trying to reframe the conversation in a really powerful way by looking at the goal is not to avoid medication. The goal is to avoid disease and minimize your risk. That's an important distinction. So it's not about whether I'm on a statin or not. It's not about moral judgment or willpower. It's about lifetime exposure to particles that can damage the arteries. And many women are told your cholesterol is normal. But normal does not always mean low risk, especially over decades, especially after menopause, especially when genetics can be involved. This is why two women can live in the same lifestyle and have very different outcomes. So I want to be clear. This podcast is not telling you what to take, whether take a statin, not take a statin. No, obviously, I said before, this has no way, shape, and form any kind of medical advice. I'm just inviting you to think differently and have more in-depth conversations with your healthcare provider. Some women will benefit from statins. Some will benefit from alternatives. Some need lifestyle support and monitoring only. So the problem is it's not medication. The problem is lack of conversation. I'm all about this conversation. Because you know what? I've seen too many women dismissed, rushed, or left worrying in silence. Waiting is often framed as being cautious, but waiting without understanding risk is not neutral. I help women navigate their physician visits. I coach them. I give them the right questions to ask if you need that help, please reach out. It's all about keeping the rapport going with your physician, asking questions, not going in as an expert, just going in with, here, I'm curious about this I read. I'm curious about this. Can you explain it? Can you explain my long-term risk for cardiovascular events? So there is some additional blood work out there, and I was actually surprised a couple years ago. I had to get a consult with a cardiologist, and I saw this blood work, and I was like, wowza. It wasn't just the cholesterol, total lipid profile, ratio, HDL, LDL. It was a lot, and it had to do with particle size and APO. So I just want to share this, and it doesn't mean everybody's indicated to get it, but I just want to share this because sometimes we're told that's all you need, but there is some additional blood work that I just want to talk about, and they're blood markers. It does get a little complicated because even me scratching my head, I want to really thoroughly understand it, and I have nursing medical background, but I think this might be an easy way to explain it with an analogy. Think of cholesterol like traffic. Traditional cholesterol tests tell us how much cholesterol is moving around, right? Moving around. But these additional tests focus on how many particles are carrying that cholesterol. So like traffic, you can have a small number of cars carrying a lot of luggage, or a lot of cars carrying just a little. Both situations may look similar on standard tests, but they aren't always the same experience for the body. So there's something you might have heard of called APOB. That's kind of a broader view of what's circulating, like counting the number of cholesterol vehicles, if you would, from our traffic analogy in the bloodstream, how many vehicles are in that bloodstream. It does not replace traditional labs. It simply offers another way to look at what's happening. And for some women, this explains why their numbers look okay on paper, but something just doesn't feel quite right. Then there's the APOA. That's kind of looking at what I'll say is the body's cleanup crew. It's connected to the HDL, often thought of as the cholesterol involved in cleanup and transport. So rather than focus on good or bad, this marker helps paint a picture of how the body moves cholesterol around and clears it out. So again, this is about understanding, not diagnosing. And there's some reasons why you might not have heard about these tests. It may not be indicated, and not all doctors order these tests. They're not part of routine screening necessarily for everyone, and the guidelines vary, and insurance coverage can totally not cover it. But again, this is just being more empowered to ask the questions to figure out, do you need it? Would it be helpful? I always say before you get any test, not just these tests, find out what the test is about. Find out if I get what the result is, what would be the action that might be taken. If it makes no difference, then do you need to do the test? Or if it does make a difference, let's do the test. But again, it's a long conversation, and all I say is just stay curious. If you haven't gotten these tests, that does not mean your care is lacking. Might not be indicated to have them, but worth just a conversation. Sometimes people we work with, standard checklists that doctors work with, and they have to be careful that they're not going above and beyond what needs to be done, or that there's enough evidence base to actually order the test. So there's a lot that a physician has to go through in order to have these tests done. It's not for everybody, and you don't want it done if you don't need it. So just remember that. But the real takeaway I'd like you to have is just more clarity. Not necessarily needing more tests, just having a greater understanding of what this means. When women understand that different layers of information exist, they feel less dismissed. They have a bigger conversation with their doctor. They feel more confident asking questions. Once you feel good about your relationship, I always talk about the relationship with a doctor is half your healing. So developing that rapport that you feel comfortable asking these questions and you're getting a good response and you feel more engaged in your care. I do say awareness doesn't create fear. You will be less fearful when you get all this information. It really creates agency. And it's important to make sure you're focused. As I said, I coach women, men, going on their doctor's visits to be very focused, have an agenda, have a little list of questions. Don't do any sidebars. Don't be talking about some other issue. You talk what you're there for. You want to honor his time, and then he honors your time, and you have a way better conversation. So get your list together. And I've heard women say, I was kind of given the bum's rush. I was like, you're never given a bum's rush when you come in focused and you have a list in front of you and say, Doc, I have 10 questions. I got 8 done. I got 2 more to go. Something like that. So this isn't about deciding what labs to order. It's really about helping you all understand that there's more than one way doctors look at heart health, and that it's okay to ask questions and to get a second opinion if you feel you'd like to. So again, I share this information for education and awareness, not as any kind of medical advice. So with this being Heart Month, I want to go over the signs that you need to recognize for women having a heart attack. It can be very different from men. And men typically have that heavy chest pain, elephant on the chest, pain radiating down the left arm. Doesn't mean a woman can't have that. She can. It doesn't mean a man can't have it, something else like a woman has. Like I had a coworker had upper shoulder, upper back pain. That's all they had. Heart attack. Another, actually, it was my cardiologist from years ago. Just had terrible indigestion. Heart attack. So again, I just want to pause for a minute. Let's all take a deep breath. This isn't about fear. I don't want to create fear. I want to create awareness and have you be proactive, because awareness and being proactive saves lives. So a heart attack in women can present a little bit different. You can have that chest pressure, tightness, or discomfort. You could have just pain in your jaw, your neck, shoulder, upper back, or arms. Shortness of breath is also potentially there without chest discomfort. I knew when I was doing my parish nurse program locally here, there was another nurse from a local hospital who for 2 months couldn't figure out why she was short of breath. It wasn't awful, but it was there. It was present. Shortness of breath walking up the stairs. She got worked up, couldn't find anything. She ended up having a heart attack. Survived, thankfully, because she kept on it. She just kept on it. And you can also have unusual and overwhelming fatigue, sometimes for days or weeks beforehand. You can have nausea, vomiting, indigestion, or stomach pain. You can have cold sweats. You can have dizziness or lightheadedness. I've also heard from many patients after having a heart attack, when they go over the symptoms they were having, they also say something kind of isn't always listed, but they had this sense of impending doom, and they had to go. They had to move. So just a lot of symptoms just to be aware of. And again, it's always better to be safe than sorry. And you get through the line in ER if you go 911. So when in doubt, 911 it. Some women just say they don't feel right. And if that's the case, move forward and get medical care. If something feels off, do not wait a second. Do not minimize it. Do not worry about being polite. You move forward. I had an incident with myself. I won't go into the details. I had to get into the ER. My son had to drive me. I went barreling in like a barracuda. I went up to triage. I moved everything out of my way. I said, I got to go, and I got to go now. I don't know what you people are going to do, but we're moving, and we're going now. So no being polite. So signs of a stroke. Use the acronym FAST. If you can hold on to this FAST acronym, F stands for face drooping. There could be face drooping. A stands for arm weakness. Arms could be drooping. Arms could be weak. Ask somebody to raise both their arms up to their shoulder height. If they're having a stroke, one arm probably won't go. S is for speech difficulty. Have them talk a lot. They might just go no or yes, but have them talk. Speech difficulty. T, time to call 911. Again, when in doubt, you call 911 because time is of the essence. Women, well, men too, but you can experience sudden confusion with a stroke or trouble understanding or speaking. Vision changes in one or both eyes. You can have dizziness, loss of balance, or trouble walking. You can have sudden severe headaches with no known cause. You can have nausea or fainting. I had somebody recently that had lost vision for 15 minutes. Almost wasn't going to do anything till I got involved, and I said, oh no, we're going to the ER. They had a TIA in their retinal artery, which luckily for them, they'd been on a blood thinner and that probably resolved it. But that was a mini stroke in the eye artery. Somebody else had called me last year and said they were having tingling in their left thumb. So when I asked a lot more questions, this person had been experiencing this in lesser intensity over the last, let's say, 8 weeks. And when I asked the question, why are you calling me now if you've had this before, I got the answer I needed. Well, it's worse than it is. I'm a little worried. Okay, off to the ER. Transient ischemic attack, mini stroke. Both cases had a good outcome because we went quick. So with a stroke, just minutes matter. So just don't ever think you're overreacting. Just get attention immediately. This is not fear-based. This is love-based because you love your heart, you love your brain, and we want to take care of it as best we can. So I just want to go over quickly as I get close to wrapping up here, the emotional piece for women. Here's what I see emotionally with midlife women. Taking medication or even needing to consider it can feel like admitting defeat. Oh, I thought I was so strong, doing everything right, and I wouldn't have to take medication. I'm 60 and I haven't been on anything. Who cares? Look at your risk. Minimize your risk, right? Or they feel like, oh, I'm getting old. I got to take medication. I'm getting old. Or they think something's wrong with them. You know, I want to reframe that right now because we're not letting that old lady in, whether she has heart disease or not. I got some diseases. I'm not getting old. What if prevention is not about control, though? What if it's about care? Right? Let's reframe it. That's the best thing you can do for yourself is give yourself a medication. That's self-love. That's not worrying about being perfect and not having to take a drug and doing everything right and yada, yada. It's protection, especially if you want independence later in life, or you want good cognitive health, or strength and vitality well into your later years. Let's take care of ourselves, ladies. You do not earn health by suffering. You do not prove worth by avoiding help. So here's what I want, to take away today. You deserve clear, unhurried conversations from any healthcare provider. Numbers without context are incomplete. Let's get those good conversations going. Prevention is proactive, not fearful. And most importantly, you are allowed to ask better questions. You are allowed to advocate for yourself. You are allowed to design your aging intentionally. This is what not letting the old lady in actually looks like. And if you need an advocate, call me. I love to advocate for people and get them the best possible care, the best possible mindset, and live gracefully as you age. So if this episode resonated with you, please share it with all your women because it's life-saving, some of this information. Save it and listen to it later. And remember, your future self is listening to the choices you make today. Remember, when you speak about yourself, your body hears it. So be careful how you speak to that beautiful, wonderful body, no matter what shape you think it's in. It's wonderful. So stay strong, stay curious, and don't let the old lady in. And until next time, ladies, stay well, stay happy. And that's a wrap on today's episode of Don't Let the Old Lady In. Remember, age is just a number. Your mindset, energy, and passion are what truly define you. If this episode spoke to you, don't keep it to yourself. Share it with a friend. Subscribe and leave a review so we can continue this journey together. You are strong, vibrant, and unstoppable. Until next time, keep living boldly, loving yourself fully, and most importantly, don't let the old lady in.